Hey guys, back with another Q&A on Monday, January 8th, 2018. um, let's see, this week I posted up the thread yesterday and wanted to talk about post-show period or post-fat loss period, anything along those lines. Um, as far as training, nutrition, cardio, tapering, all that stuff, and what have you. So, uh, let's see. Check out the questions. Can you talk a bit about tapering up into training volumes for off season, and also tapering down cardio from prep levels? How much, how soon? Are there standard percentages people can apply? Like, say, take whatever level of cardio your highest was and take it down by 40% as a general guideline. Okay, so part of this depends on the nutrition thing also, because with the cardio, all right, well, I'll talk about the training first. This is a multi-part question, so I'll do the training first. Now, with the training, it's going to kind of depend on what the end of the prep was like. If I do think that at this point most people are kind of beat up, it's obvious. I mean, you're going to be a little overtrained or a lot overtrained depending on how many shows you did, how long was the prep, how hard was the prep, etc. So the training is going to kind of depend on those factors, obviously. Now, I do like to have most people train right after the show in some way, shape, or form. I know some people they're like week after taking a week off, or whatever. I don't really like that for most people, just because well, you have a lot of glycogen, you're super compensating at that time, you have all the electrolytes. I mean, you're full, very, very full. You're probably watery, but you're full. At least go in and move the blood, move the glycogen around, get everything where it should be, let the water redistribute itself, and take advantage of that extra glycogen there. And you might do this for a couple weeks even. Nothing to failure necessarily, but still at least a moderate amount of volume and all submaximal stuff, doing the things that I mentioned before. Versus just sitting on your ass and continuing to eat and eat and eat and eat like a lot of people are doing, and not training and taking all your cardio out. A lot of people do that as well. That's just a recipe to get fat way sooner than you need to. So as far as let's say we're past that, week or two period or whatever, maybe they are pretty beat up and we need to do a small deload at that point. Okay, so we're past that, ramping things up. I would like to, first and foremost, I would really like to ramp up strength versus just adding a ton more training in, because we're trying to get into a calorie surplus. Obviously, we can do that through nutrition. It's probably not going to be too difficult since the metabolism stuff's going to be pretty down regulated at that point. But in order to kind of preserve and not beat yourself up anymore in terms of just doing more and more and more work, I would rather just let the strength increases, progress through the progressive overload side of things for a while at first. Keep your volumes similar. If you had to cut out some of the compound movements at the end just for safety's sake or whatever, get those back in, get progressing again, try to get your strength back up to a decent place. And then once we're getting calories really topped off, metabolic rate and stuff topped off, then start, and then start, you can work the volume component from there. You could look at it that way. Other way I would look at it is if the person they had a really, really hard prep. It's really, they're really having a hard time recovering. But I want some form of progression. We did deload, we did rest. They can train, but it's probably not in their best interest to go in and toss around tons of heavy weight. Well, then I might milk the volume side of it a little bit more with a little bit less load. Enough load to stimulate hypertrophy, break down the muscle fibers, what have you, but not necessarily beat the person up. So we might slowly increase volume from that point. That would be, so there's two different scenarios right there that depending on where the person's at. Beyond that, it's hard for me to say, okay, do this exactly, just because, it's obviously very person dependent. But going back to the cardio part of it, so this is, actually, you know what, before we do that, they also asked about frequency and intensity as well, so I can touch on that real quick. With the frequency thing, that's just totally dependent on the person as far as what they want to do. Really, the total volume is going to be the biggest thing. If you want to split it up into more frequency, that's okay. From a recovery standpoint, that's probably not a bad idea. Whether you're post-show or deep off-season, it could be a pretty decent idea for a lot of people. Maybe they prefer to do all the volume at once. It's personal preference how you recover. But intensity levels, I kind of touched on that, so I really already covered that as far as the two different main scenarios there, and then beyond that, it's just the subcategories of wherever people fall. So cardio is going to also be dependent on the nutrition. So a big mistake I see with a lot of people with the cardio is that they will stop doing cardio altogether, or they chop their cardio way down to hardly anything, or whatever it is. And they also increase their calories simultaneously, right? We want to create a caloric surplus, we increase the calories, which is fine. But the problem is, if someone's doing, a good amount of cardio and they slash a lot of that and they increase calories, that surplus is much bigger than it needs to be at that point. And the surplus doesn't need to be extremely excessive to grow, especially if you're trying to maintain some semblance of condition. So I would say this is a couple rules of thumb I could use in this scenario, in this situation, post-show or post-Fatloss period. If they're doing a lot of cardio and their calories are decent, then, cut the cardio first. Start creating your surplus through cardio. And a little bit less in the nutrition, and then vice versa. If the nutrition's low and the cardio is not as bad, then start adding calories in first. Get the dietary fats up if they need to get their hormones back in check. Get the carbohydrates up if metabolism's really downregulated. Get the thyroid moving, and all that good stuff. So you could look at it both ways. Now, if everything's food's low and cardio is high, which definitely happens, then obviously probably going to want to go about halvesies on that. Go a little bit from each section. So with that being said, is there a percentage? Not really, but you can obviously, like, if you take those two scenarios and you say, I want this much of a surplus, I want to add 500 calories a day in, and you need to add a little more of that through cardio reduction versus calories. I mentioned the scenarios. Then say, okay, I'm going to do 75% of that through cardio reduction. I'm going to do 25% of that through a nutritional increase. Okay, so there, bam, there you go. Or roundabouts. And then vice versa, you could use the opposite with the opposite scenario I mentioned. So it could go, you could go either way with it, obviously. Now with the cardio, one thing I will say too is that in most cases, I usually find it beneficial to probably pull out the most intense cardio first, pull out the HIIT cardio, get all the interval stuff out of there that's really taxing and is going to impede recovery. If I have that kind of stuff in the off season for different reasons, which on occasion I would probably put it in later after everything's more stabilized, but first and foremost, try to get that HIIT cardio out of there because it's going to be the most detrimental to the recovery process. So let's see, anything else I can really add to that. Not necessarily. I mean, like I said, I gave you two main scenarios, and then obviously the third being if everything starts out low food, high cardio, then get a 50, go 50-50. And as far as like how many calories to make the actual surplus, this is really tricky. This is a shot in the dark a lot of the times, sort of just because you're going to have a lot of metabolic upregulation that's going to happen in some people and some more than others, and it's just going to be really difficult to predict exactly how big. This is a situation where, let's say you're deep off season and you're eating, so you have someone they're eating 4,000 calories, okay? So their metabolism's not going to really fluctuate that much. Like it might adapt up and down a little bit. But you pretty much know, hey, if they're eating 4,000 calories, I add 200 or 300 calories a week, they're probably going to gain some weight. It's probably going to get things moving again in most cases. That's not necessarily the situation here. If I know someone has a really adaptable metabolism, I'll probably be a little more aggressive at first until that kind of tapers off. Glycogen stores are full. Some of the hunger signaling is full. Or is leveled off. They are kind of leveled off on weight. Everything's stable. Then I might slow it back down. If someone's pretty linear, their metabolism's not really works in waves that much, but obviously I know they're going to be down regulated some. I might do a little bit less on the increases, and because I know that they're probably going to gain weight when I increase things a lot quicker. They probably don't need the bigger increase. Like someone like myself, I might have to come out pretty fast out of the gate, make several increases before anything really happens, and other than just gain glycogen and then and water, and then I'd slow it way down. So, and then some people are like that, more extreme than others. So I think I covered most of the scenarios there. There's several different questions there, obviously, so might have to go back and re-listen, but I've got quite a bit in that one. Okay. So there's one more main question that I wanted to cover. It might take a little bit too, so let's go over that. Is there really such thing as a rebound, aside from the initial water weight gain from sudden carbohydrates, sodium flux post-show, and can enhanced athletes benefit from a few weeks of pushing the envelope hard PED and food-wise before pulling back in hopes of maximizing sensitivity such as from being in a lean state? So, okay. So so two questions, actually. So first one, such thing as a rebound. Well, if you were to look at what rebound should mean is negative. You know, you're rebounding, it's a bad thing. But I know what the question is asking. Is there anything as like the magical such thing as a rebound or the magical, post-show period type of thing? Yes and no. You are obviously very insulin sensitive at that point. However, adipose tissue is ready to fill back up as well. So, I mean, the sensitivity goes beyond muscle tissue and, liver glycogen and stuff. So, it is and it's not. So, the thing about it is that I posted about this the other day. Is people like to go too fast and they kind of they come out of the gate fast, which is okay in a lot of cases, but they don't slow down. That's the problem. The problem is they don't slow down until they already have accumulated fat. Just because, they're filling out. They look great. They're not gaining fat. They're looking better in some situations with pretty minimal fat gain. So that's where they just keep going and they think, okay, this is great. And then all of a sudden, bam, they spill and start looking like shit and the fat piles on and they don't know what to do when, so that's an issue. Now, I like I would say it's probably not really a magical period, but if you can take advantage of being insulin sensitive in the muscle tissue, it can be very productive. You might not necessarily be the most productive training wise. Like, you're obviously going to probably gain strength because you might be weak as shit before the show, like once you actually get the show time. So yeah, you're going to be able to gain strength. You're going to be able to get back to at least the old lifts, hopefully, from previous off season, or slowly but surely. But it might not be necessarily like the craziest time training, maybe for some people, but if you can get that initial period where you fill out and everything is stable, and then you make the increases more, you make the calorie surplus more modest at that point, then it surely is, it surely is a good period of time. It's just, like I said, people get too fat too fast, and they shorten that time period because they have to go in and clean things up and try to reduce body fat way too soon. It's like if you're 2 months post show and you already need to do a mini cut, then there's an issue. You went way too fast, or 3 months, or whatever time period you want to give it. You should be able to go a pretty substantial amount of time if you are really lean to compete and you do things right. So that's kind of the long and the short of it. And obviously with the glycogen in the water and all that flux and super compensation type thing that we talk about, yeah, I mean, there are benefits in nutrient delivery and stuff, and swelling and inflammation and all that jazz. But beyond that point, like what I said previously, is kind of the gist of it. Second question, can enhanced athletes benefit from a few weeks of pushing the envelope hard, PED and food-wise, before pulling back? And hopes to maximize the sensitivities from being lean. Okay, possibly. Now, this is kind of the decision you have to make. You have to kind of look at, okay, where's your health? Where's your health at? What did you do prior to the show? Is it a risk? Is it a risk you really need to take? Is it necessary? So a lot of the things are going to be maybe in your system for a little while after the show anyhow, a few weeks, or just depending on what it is. So you're really going to get that, you're really going to have something there anyhow, at least for a little bit. But as far as like leaving things in, that is a judgment call it's a tough one to make sometimes. Like, I get different, clients ask different questions, and I've had some ask about it or say or speak against it. Like I said, it's totally a judgment call. Like, there can be benefit to it if you're just saying throwing caution to the wind as far as health wise and none of that matters. And of course, there could be benefit to it. Depending on if your body's totally beat up to shit and you're just in a very toxic state, then probably not so much. But some people, there might be a benefit to it. Though what I would prefer with most people is take advantage of the fact that you're very insulin sensitive during the period. So some people might benefit more from certain compounds that will take advantage of that more so, like growth hormone, insulin, things like that. If people want to use those a little bit more, that might be a little more appropriate for the time period. It's not taxing in the same way that the androgens are, so you can kind of utilize it a little differently. Hard judgment call. And it's definitely one that everyone's going to run into. Most people that are enhanced are going to run into one time or another. They have to make that decision. So I think that is it, guys. Those are some good ones. So I appreciate the questions, and we're coming up about 20 minutes. So perfect timing, and I will talk to you guys next week.